I needed to find a way to deliver good quality health care to people who didn't have a lot of money. And so I needed to find cost-efficient ways. And then Hurricane Katrina came. But because of experience, I knew that we had to get everything out of there within 48 hours or it would mildew and we'd lose the ceiling, we'd lose the roof and everything. Prior to that, we'd always said, I'd like to have electronic records so that if we ever have a hurricane again, we'd have it. But they were unaffordable. And then when I walked in and saw this, I was just devastated, and I was like, I wish we had electronic records, because my employees had said, we don't want to dry out records anymore in the sun. We've got to do it again, because the previous time we had turned them over in the sun. It's like baking and cooking, drying them out, trying to make sure they didn't fade. I even use waterproof ink. To this day, I use waterproof ink. We spent a lot of time. We spent as much time on the record as we did on the building, trying to dry them out. And even when we opened the building back, we put them in a file cabinet and tried to make sure they were in a metal cabinet that they'd be safe if something happened. And New Year's Eve night, the fire happened and lost everything. So all those records we had dried out, we had saved, then burned. And so then I was determined we've got to have electronic record. There's no way we can't. This kind of just tells me everything about the patient, the entire medical record. One of the neatest things I think about it is the fact that I can pull up all of her medications. It'll tell me I've got interactions and to be careful that these medicines will interact with each other. The yellow is a slight one. These are a little more serious. The red ones are very serious. I'd like to be able to use it to improve the care that I give patients. For example, I like to pull all the, just click a button and say, you haven't had your mammogram, it's due in 2 days, so you need to get in here. Things that I would have to pull every paper chart before to find that out. And now I can do it with the touch of a button.